What are the proposed cuts to Medicaid that are in this budget reconciliation bill? This comes from a video where I'm discussing the fact that it is not factually correct to say that the Republicans are planning on ending Medicaid, but they are planning on instituting some substantial cuts to the services and things that are covered under Medicaid. And I think it's important to note before I go into a discussion about these potential cuts is that the goal of my content is I'm not here to be an alarmist. I think there's a lot of creators on here who want to say jump to extremes. And I think in this environment, especially when there's a lot going on, I want to save my alarmist, like this is a crisis, for when there's actually something substantive that we can point to. My content is all based on factual information and I cite all of my sources, and that's why I want to correct the record. Because as you can see in the video that I previously stitched, the caption says they want to end Medicaid. That's not exactly what's happening. And of course, these cuts to Medicaid potentially have the impact of disenrolling people from their health insurance and potentially have negative health outcomes, which is something I want to talk about in this video. Again, for those of you that need a refresher, Medicaid is the public health insurance program that covers around 80 million people in the United States. We include CHIP, which is the Children's Health Insurance Program enrollees, in that sum. Generally, what Medicaid covers are individuals who are poor, pregnant people, children, people with disabilities, and in those numbers, there's actually quite a bit of seniors who are in long-term care facilities because that's the only way you can pay for something like a nursing home in public health insurance. See, when talking about these cuts, a lot of Republicans claim that they are trying to attack the fraud and waste and abuse in our public health care system, specifically with Medicaid. Which is interesting because we can actually look at the Medicaid improper payment rate, which is the rate that we find missed billings to Medicaid, to measure this. We find it's actually 5%, and it's actually come quite a bit down in the last couple of years. And a lot of this comes from administrative error or accidental error. It doesn't come from this purposeful misbilling of Medicaid. What we do find is when we look at Medicaid, Medicare, and private insurance actually has a substantively higher per enrollee spending rate compared to Medicare and Medicaid, and it's growing a little bit faster just by looking at this chart. And so Republicans are not looking to cut the entire program of Medicaid. But it's important for us to talk about specifically what they do plan on cutting because it will have significant impacts about how Medicaid actually operates. Again, this is the list of Politico from the House Ways and Means Committee, and it's looking at all the different components of Medicaid along with other environmental and education and health programs that they are considering